Hi, my name is Jhon, and my student number is 210904. I'm presenting my presentation on activity quality management. And my client profile, my client's name is Shakir O'Neal. He's a 70-year-old American male. He's diagnosed with chronic fatigue syndrome, also known as CFS. He has migraine and depression. Shakir used to live with his family. Um, their names are Marvin, and he used to live at Paulson Street, Addington, New Zealand. He was an IT data entry worker for Wright Electronics, and this is because of his chronic disease, which is the CFS. He couldn't do any physical activity because it will make him tired, so he became an IT data entry. He retired at the age of 60 due to health complications. He also had cardiovascular problems due to the CFS as well, which limited his physical activity. So now Shakir resides at Ryman Retirement Village. Shakir was born in Tennessee, USA. He flew to New Zealand with his wife Hermione by the age of 25 to seek a better life. His hobbies are playing board games, puzzle games. He also likes watching movies. He was able to compete at one point on competitive chess because it was the only hobby he could have, having lack of physical activity because of his disease. He used to play checkers and other puzzle games with his wife for quality time. Though he's physically unfit, he's socially active. Not being able to get out of his room, he's still able to find some time to talk to his residential friends.
Good.
His mental state is decreasing. He's mentally unhealthy right now, suffering with depression, having insomnia. He also has limited support from his family because they're busy in life. He usually forgets information and gets headache due to migraine. From earlier, Shakir is socially active. Yeah, he was described to be very easy to get along. He is joyful, usually initiate conversations with other residents. He also likes to listen to some light music, and he likes getting massages. Spirituality, Shakir is a Christian. He goes to church every Sunday. If he's not able to go to the church, he's watching a Sunday Mass in a television. He also respects other people's beliefs and point of views in religion. Shakir's emotional state is very good, but he usually uses his IQ in certain situations, such as his feelings or going on his way of his goal. Depression. So he has depression, and depression is a mental health problem that makes you feel very low. It makes you feel tired, gives you insomnia because of the lack of sleep. You become moody when you have depression as well. Hopelessness is one of the symptoms, which is usually the cause of suicide. The cause of depression is stress, illness, trauma, and social isolation. He also has chronic fatigue syndrome, which is probably the worst syndrome he has. CFS is a complicated disorder. It basically makes you fatigued even if you're not doing any physical or mental activity. Its symptoms are, yeah, fatigue, problems with memory, concentration, sore throat, headaches, and it usually causes cardiovascular problems. The causes for this syndrome is still unknown. And the next one is migraine. Migraine is basically a severe headache. It's a sensation of throbbing pain, a pulsing sensation. It's usually on one side of the head and accompanied with nausea, vomiting, and extreme sensitivity to light and sound.
Got it.
Its syndromes are not all people go through all the syndromes, but there's basically four types of symptoms. It usually affects your brain. It causes prodrome, attack, and post-drome, which is like a headache. The causes aren't fully understood, but it is said that genetics and environmental factors appear to play. The examples are hormonal changes in women, drinks, stress, and medication. So these are my activity plan for Shakir. As you can see, there are a lot of rest time due to his CFS, and there is no physical activity that could get him fatigued.
Okay.
I chose massage therapy because, like I said earlier, Shakir likes getting massages, and massage has many advantages like reducing stress, increasing relaxation, reducing body pain, muscle soreness, and tension. It also improves your blood circulation, energy, and alertness in your surroundings. So I planned a 1 hour massage therapy for him, just so we don't overdo it, because I think 2 hours would be too long.
Yes.
I have booked a masseuse, the one that specializes in elderly. I've prepared water and clean towel for him. Evaluation, he likes having massage therapy, and he requested to have a weekly therapy of massage. Our travel to the masseuse wasn't very pleasant for him though, so my adaptation for it was I'm gonna bring a wheelchair next time to basically limit his movements so he won't get fatigued.
Good.
The next one is movie therapy. Shakir's hobbies is watching movies as well. He usually watches it with his family. Movie therapy has a lot of benefits like boosting mood, relaxation, boost of motivation, reducing stress, and to also inspire him to become more socially active. I think movie therapy would be great for his goal to reduce his depression. Planning, so 3 hours, because most movies are 3 hours long. My implementation is having some clients residential over, because this might get his depression out of the way. I would ask the client for his favorite genre, just to get it started with. But on the evaluation, he would like to have a different genre on every week of the movie. A problem occurred though when the speaker was too loud, and it triggered his migraine. So my adaptation with it will be using smaller speaker, or just basically turning the volume down to stop triggering migraine. The next one, Sunday Mass. He's been going to church every Sunday, but I think I could add this to his activity planner.
Okay.
because church is a community, and it gives us a sense of belonging,
Mm-hmm.
and it builds a support network that you can rely on, which is good to reduce his depression as well. Timing, his church is usually 5 hours long because they're Christian. They usually have preaches and songs and basically festives. Implementation, I would have a experienced driver to drive him to church.
Yeah.
I've prepared water and lunch for their lunch breaks if there's none in the church. I'll also make sure he's in a comfortable wheelchair to get the CFS out of the way. In the evaluation, he was able to attend the mass, but at the same time, he feels really sad when his family is not able to come with him to mass. He also had some migraines, headaches during some of the songs and preach. It was probably because of the sound. So my adaptation would be having the client's family to contact them, come with him every Sunday mass, or also have him just go onto Sunday television mass
Okay.
to avoid having migraine. And that's my presentation. These are my references. Thank you.
Thank you.